Hey everybody, how are you doing today? It is Friday, September 29th, I think. Yep, Friday, September 29th, and we are talking about placebo today. Welcome. Don't forget to hit like and let me know you're here. Let me know what you're drinking on this lovely Friday afternoon. I am still trying to suck down my water, so hope you're enjoying something better. But in case we haven't met, my name is Amy Eicher, and I am a chronic pain coach and best-selling author. And I help motivated women experiencing chronic pain get back to the lives that they love through the use of education, movement, and self-discovery. I experienced 20 years of pain myself, and through a very long and very twisting discovery, did find my way to a far bigger, far more enjoyable, and pain-free life. And I'm here to help you do the same. So I said today that we were talking about placebo. If you got a chance to read my blog post, you know that I went into depth on the idea of placebo and nocebo. But just in case you haven't had a chance to read it yet, let me give you a definition. A placebo is an inert substance or treatment that has a story attached to it and sensation, be that visual, auditory, being able to smell it or taste it, has a sensory experience attached to it that we feel positively about or are made to feel positively about. So the placebo isn't just the sugar pill, so to speak. It is the combination of the experience and the story that goes with it. Now, I want to be clear before I go any further that I am talking specifically to the person receiving the placebo. I am not talking about its use by clinicians. Clinicians should be educated, and you should know which intervention, treatment, medicine, surgery, depending on your role as a clinician, you should know which tool that you use is a placebo and is inert and is only helpful because of the story that accompanies it. That is your responsibility to know, and this conversation does not apply to you. But because I spend so much time debunking myths and I keep taking things away from people, I want to show them how placebo or inert experiences connected with story can actually be helpful in decreasing our pain. So clinician, know your role, know your tools, know what you're doing, and you should not be using placebo. You should be properly explaining what you are doing to your client. Okay, all right. With that out of the way, let's talk about one of my favorite Disney movies. I've been using this illustration quite a bit this week. But so if you're still not really sure what the placebo effect is, I'm going to encourage you to watch the movie Dumbo. And I'm going to give you a short synopsis. Cute elephant, giant ears, gets adopted, sold to a circus, and is supposed to be in this circus show where he flies because his ears are so big. Dumbo doesn't think he can fly. He's got this little buddy, Timothy Mouse, that rides along with him and is often seen in his hat or walking alongside him. So Timothy knows that Dumbo can fly without the help of anything, but Dumbo is not convinced. So Timothy finds what I believe is a crow feather and gives it to our friend Dumbo. See, there's my Dumbo with his crow feather in his nose, right? So Timothy gives Dumbo this crow feather. The crow feather would be the inert object, right? There is no magic to a crow feather as far as we know. And Timothy says, Dumbo, you take this feather and it's going to help you fly. It's a magic feather and it's going to help you fly and you're going to be able to do whatever you need to do. And Dumbo's like, awesome, takes the feather, starts flying, right? Super cool, yay Dumbo. Dumbo is in a situation that's very panicky. There's fire everywhere towards the end of the movie. He loses the crow feather out of his nose and starts to nosedive because he doesn't think that he can do it without the feather. This is where placebo's a problem. We have to believe we can do it without the feather. But for the sake of the explanation, Timothy, in the fire, sitting in Dumbo's little hat, starts screaming at Dumbo, Dumbo, you can do it. You can fly. You've been able to fly all along. And Dumbo finds faith in himself, takes off, and he and Timothy and saves everybody and saves the day, because this is a Disney movie. So the sad stuff is always with the parents at the beginning. But Dumbo has a placebo given to him by Timothy. It is a feather that he can hold, and he is told a positive story about it, that it will enable him to fly, which is the thing he needs to be able to do. What research has told us is that in medication, the size of the pill matters, the color of the pill matters. The more expensive it is, the better likelihood that it's going to work. So a red capsule that is large is a better placebo, if you will, than a small white pill, which I find absolutely fascinating. But for whatever reason, our brains interpret that size, shape, color to be more effective than something smaller and of a different color. But the exact same thing can be in the medication, and one is more effective than the other. Other information on placebos is that most orthopedic surgeries done for pain are no better than placebo surgeries. What's a placebo surgery, you ask? That's a great question, because I asked it myself. It is a surgery in which the surgeons knock you out, they take you in, it's done in a study, of course. The surgeons aren't doing this like, down the street. This is not, this is part of a research study. But they knocked him out, they went through the motions, they handed the instruments across the table, they did all the things that would be done in a surgery except for actually, manipulate the tissue. And what they found is those that went through knee, shoulder, I know they did it on the knee and the shoulder, and that they've done it on other body parts. I watched a video on the knee, but the people that had the knee surgery, the ACL reconstruction, fared no better than the people that had the placebo ACL reconstruction at a year out. And I find that insanely fascinating. Now, again, I understand the ACL was torn. We've talked about tissue issues in normal people versus people in pain, but the purpose for the surgery was because the knee hurt, and what they found was the ACL to fix. And then they found that people that had sham surgery were no different a year later than the people that had the real surgery. What does that tell us? Well, for me, I think it informs us on two things. One, the story that accompanies the treatment, the medicine, the surgery, the PT exercise is far more important than we ever realized, right? So that the story that accompanies the treatment is often more important than the actual treatment itself. That can work in our favor. That can be positive. The negative side to that is there is a lot of unnecessary surgery, a lot of unnecessary medication, and a lot of unnecessary treatments going on. Which means we, as the people in pain, as the consumer, if you will, because if you're in the United States, we are a consumer-driven medical system, right? So we have to purchase it, unlike other countries. I will say this research goes, like, the research is about humans. It's not related to the way that we pay for our medicine. However, the United States is particularly behind, if you will, let's go with behind, on updating itself on treatments. What do I mean by that? All right, I'm gonna pick on my own world, which is manual therapy and physical therapy. Right? So as a physical therapist, I have a slew of manual techniques that I have been taught. And in school and in the continuing ed classes, we are given explanations for why the instructor thinks these things work. Research has proven the explanations wrong, which is what I keep coming and telling you. But as a clinician, I have been taught numerous skills that are supposed to change your fascia. I can lengthen it, I can uncrinkle it. I'm supposed to tell you this story about how fascia is like a sweater and it's all over your body. Anatomically, that's true. And then when you're experiencing pain, I talk about, you're taught to talk about how this sweater is like got a snag and it's all bunched up. And when your sweater snags, it like pulls out of shape. And that's what's happened to your fascia. And then I'm going to do this thing with my hands and I'm going to smooth that all out again, right? I am sure, let me hit like in the comments or say yes if this is a story that you have heard somebody touching you share with you. So that sounds cool and all. You go through the experience, you have your fascia manipulated by your physical therapist or your massage therapist, you feel better at the end of the treatment. And now what you think is, well, every time I hurt, it's because my fascia is all, bunched up like this sweater and I need somebody to smooth it out. That is a magic feather. Why do I say that? Well, because research, my goodness, words are hard today. Research has shown that the human hand cannot do anything to change fascia. Your nervous system, which is connected to your brain, can change the resting tone of things, but the human hand cannot. So if I were to do massage techniques where I'm putting hands on somebody and hoping to relax them, the story that I'm going to join to this action is going to be very different. I'm going to tell you, hey, I'm going to touch you. Hopefully this is going to feel good and it's going to relax you, and that's going to relax your muscles and it's going to decrease the tension and hopefully decrease your pain and enable you to move better. But I'm doing the exact same thing that the person who explained the fascia story is. The difference is that I am attempting to be less wrong in my explanation of what's happening to you. That's where we have power as clinicians, right? So you can be an educated individual in pain, and you can go to your physical therapist and they can use their cups and their scrapers and their hands and they can manipulate and bobble and this and that and the other thing. And what you can know is that these things are having an effect on your nervous system, but they're not doing whatever the story is about your fascia and your muscles and your knots, right? So you are smarter than that, and you know that what they're doing is they're affecting your nervous system. And if you like it, keep doing it, because that's what's helpful. I keep saying over and over, we got to calm the nervous system. There's a zillion different ways to do that, right? The research has not tested these techniques and modalities. We call them modalities in clinic, right? So it hasn't tested these things on what it does to the nervous system and how that may help somebody improve from a chronic pain state. They have tested, does it change the fascia? Does it change the positions of your joints? Do clinicians really feel what they say that they're feeling? And the answer to all of those things is no. No, these things don't do any of that, which is why your clinician really shouldn't be explaining it that way. But if they do, and these things help you, the important thing to know is that you know it's affecting your nervous system, and that we don't need to worry about joint position and fascia and knots and all of that stuff. What we do need is to feel good and to feel safe. And if those techniques, if you like Graston, right? So like the metal tools, or they call it gua sha with the plastic tools, and you like the scraping, you like that, you like to see your skin get red and raspberry, or you like the way the tool feels on you. And when that's all done, you feel relaxed, and seeing the bruise for whatever reason, that makes you feel better. It feels like something's done, that you've done something to improve your situation. Great. Because that's you setting the story. That's not your clinician setting the story. I would say in the same way, if you feel like you have to have that done to get rest, relaxation, to feel like you can move because you believe you need your skin scraped or your muscle scraped, that's maybe not so great. And I would put that in the category of what is called a nocebo. Believe it or not, that's actually kind of the opposite of a placebo. So a placebo is an inert thing with a positive explanation and a positive sensory experience. right? We believe that the outcome is going to lead to something positive, i.e. getting us out of pain. A nocebo is where we believe something bad is going to happen. So if you walked into your orthopedic office and you've got pain in your fill in the blank, go ahead and write down where you've got pain or where you've seen the orthopedic surgeon for. But let's say I go in because I've got pain in my knee and they take an x-ray of my knee and I go in to see the orthopedic surgeon and he goes, oh my God, you've got knees of a 100-year-old. And let's say I'm only 30. And these are the worst knees I've ever seen. This is the worst arthritis on a 30-year-old that I've ever seen. Those are nocebic messages. None of that's particularly positive. I don't want to have the knees of a 100-year-old when I'm 30. That makes me feel like something's really, really wrong with me, and I don't want something to be wrong. I want to get better. Phrases like, well, I don't see anything wrong, so it must be your weight, your age, your height, your color, your gender, right? That's nocebic. There is far more information out there on why you are experiencing pain than, that you're a female at a certain age and you're anxious. That's not why you're in pain. It may be contributing, but that's not the full story. So being told that the doctor doesn't know what to do next, they don't know why you're hurting, they don't see anything on your MRI without a further explanation of why you might be in pain. Those are all things that are nocebic. They are messages that are given that give us a bad, like we think something bad is going to happen because of those things. So again, to my clinician friends that may be watching this, I'm going to encourage you to really, really watch your language. We need to be encouraging, honest, truthful, and let people know that there's far more to chronic pain than tissue issues. That once it's chronic, it's far more complicated than that. Doesn't mean it's unsolvable, just means it's not that simple. So let me check my notes because I'm still a little scatterbrained post-Disney trip, but let's see. Okay, we talked about the magic feather. We talked about placebos versus nocebos. I told you that we haven't tested on what these treatments do to the nervous system. We just know they don't change the tissues like the stories that we as clinicians are told to share. And when I say story, I mean explanation, narrative, what you say to somebody that says, hey, what are you doing, right? Because we're taught that in school. We're taught how to explain these things. And what I'm saying is that at least as of 2014, that's getting further and further away now, I was taught incorrect explanations for things that I knew were incorrect at the time. I knew the information I was getting in school was already outdated and that there were better explanations for the modalities that we were being taught. So I guess what I'm saying is that just because we're told a story about something, a modality that's being done, a certain type of massage therapy or exercise, right? That you've got to make sure that your core is strong before you do anything else, right? Or you have to do these specific exercises to get rid of your back pain. That's another one. That's a big, 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 just not truism. Research has shown over and over and over again that movement of any kind, non-specific movement, is way better for back pain and getting out of back pain than specific exercises. There is no specific exercise routine that's going to get you out of pain. Moving is what's going to help you get your life back, right? So if you're seeing advertisements for the top 5 exercises for shoulder pain, or get rid of back pain now with these 3 exercises, these people are taking your money, right? This isn't real. This is a poor use of placebo. They're taking things that don't do what they say, and they're telling you a story and getting your money, and it may or may not work. That's not okay. That's clinician no, right? We as consumers need to know that research tells us movement is better than no movement. So if the only way you're going to move is by buying somebody's, 5 exercises to get rid of your low back pain, 4 exercises to get rid of your shoulder pain, Well, I guess I would rather you spend money to do that than to do nothing. But please understand, it's not magic. It's a magic feather. They are selling you movement. I just, and I'm tired of you guys spending money that isn't actually helping you. Why do I say that? Is it because I'm a pain coach and I want you to come to me and spend your money with me? Well, actually, no. Actually, no. I only want you to come to me as a pain coach and pay me if like you're actually ready to dive into all of the like the other crap and do things really, 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 really differently, because I'm not going to give you exercises. I'm going to tell you to move, and I'm going to tell you to find yourself, and I'm going to tell you to do things that matter. And I'm probably going to tell you a ton of things that clinicians have never told you, because I swear to God, if I had $1 for every time somebody told me that, I would be an extraordinarily rich woman. But it is what it is. So what am I saying? I am saying that we can take inert modalities and we can use them to our advantage. We can use them because they calm our nervous system. And if it calms our nervous system, that is a win. You don't have to listen to the story that's attached. You can choose to leave that at the door. I wouldn't bother arguing with your clinician about it, but you can know that touch is good because human beings need touch. You can know that movement is good because humans need movement, and it's how we combat pain. And you can know that it doesn't have to be the specific exercises that they had you do in clinic. But for many of you that don't know where to start moving, well, they got you to start moving, didn't they? And that is a good thing. The thing that we need to know is, when do we need to let go of the feather and know that we can fly on our own? There is nothing wrong with hiring professionals to get you started. Remember, you don't have to believe the story that they tell you, especially if you've been listening to me and you know what the current research says. Go with that. Find the things that calm your nervous system. Find the things that make you happy. If you don't like rolling on a foam roller, don't do it. If you don't like cupping, don't do it. If you don't like a specific exercise that you've been given, don't do it. Do something else instead. Do something else instead. But there's no reason to do these things that aren't actually helpful. I want to set you free from all of that. And I want you to be able to use placebo to your advantage. Because if we're really honest, if we took away everything in medicine that was placebo for the reason that it's researched, right? Because I told you, in manual therapy, the things that are researched is, did it get rid of the knot? Did it change the tone of the muscle? Did it change the position of the joint? Does the person performing the activity actually know what they're touching? Are they touching what they think they're touching? And the answer to all those things is no. But we have no idea what it does to your nervous system because nobody's checked that. So use that to your advantage. Be the educated one in the therapy department. I think I've got to be careful when I'm talking about it for surgery, but for any of you that have listened to my story, you know that I had an SI joint surgery. I've got 5 pedicle screws in my pelvis. And if you're wondering what a pedicle screw looks like, it's about the same thickness as like a flare pen, right? I love these, the felt tip pens, but it's about that thick. And I'll be honest, I'm not sure how long it is anymore. I've forgotten. I'd have to go back and look at my x-rays. But the point is, that surgery was done because I was told that my joints were moving, and I was told that my joints were moving too much because of what somebody felt with their hands. So if you back that up and you look at the research, we know that A, the person touching can't actually feel the SI joint moving. 2, the SI joint only moves between 1 and 5 millimeters, and that's even in people where it's moving too much. And we can't feel that kind of movement with our hands. So the purpose for my surgery was determined through manual tests, which research now tells us is not accurate. Did the screws stop my pelvis from moving? Oh, probably. There's 5 of them in there. I mean, where's it going to go? So I would assume that there's no, I mean, if there, whatever movement there was before, there's not now. I think that's safe to say. But the surgery was predicated on the idea that my pelvis was moving too much, which we now know can't be determined by somebody's hands. Okay, cool. So I had a surgery that was basically a placebo. I was told that it would stop the movement. By stopping the movement, we would stop the pain, and then I could get my life back and everything would be fine. Well, that ended up not being true. I ended up still being in pain for a very long time after my surgery, like a year and a half, 2 years after my surgery, before I started really getting a handle on my pain. Now, a lot of surgeons will tell you, oh, well, it'll take a year for the pain to go away. That's not how this works. That's not how this works. That's what surgeons say to be sure to cover their bum, right? So I had a very expensive placebo, and I will tell you this, and you're going to think I'm crazy, but I firmly believe that the reason I was able to get better is because I no longer had the story that my pelvis was moving all about. It wasn't sloshing around everywhere. And I didn't know the things that I know now. If I knew then what I know now, I probably would have not had the surgery. But I didn't know that, so I had it. But the thing is, I solved the story that I thought was causing my pain with the surgery. I don't think it's okay that the surgeon performed the surgery if they know that all that stuff is wrong. That's not okay. But if it was the only way to get rid of the belief that my pelvis was moving too much and I needed to stabilize it, that would be a placebo that worked out in my favor. Very expensive, very, very expensive, very lengthy recovery, went to a lot to do it. But I think sometimes there can be a place for the client, for the patient, for the person experiencing pain to elect a placebo. As clinicians, you may choose to disagree with me. I don't think it's okay for a clinician to charge money for a placebo if they know it's a placebo, if they know that it is an inert surgery, medicine, exercise. You all need to know better and do better. Us as clinicians, or us as patients, we're doing the best that we can. And we have to get rid of these beliefs however we can so that we can heal. So if you need a magic feather and you can afford it and it's not going to put you in debt and it's not going to harm you, maybe take the feather till you don't need it anymore. So those are my thoughts on placebo. I would love to know yours. Please put them in the comments. I will share the blog post that you can read more about placebos and nocebos, because I think it's important that we're educated on all those things. And just thanks for joining me. Please do all the social media stuff with the liking and the sharing so that other people can find me and get this information. And if you want more conversation, support, and information, I would love for you to join my Facebook group. I will put the link for that in the comments, and all you have to do is answer a couple questions and come join me. We had some very interesting talks about placebo this week. And if you appreciate this free content and would like to support it, I'll also drop a link for my Buy Me a Coffee, and you can donate just a couple bucks there to help me keep this going. I'm going to answer Rachel's question. She says, are the screws and rods placebo? Well, no, the screws and rods are real. They are material that was put in my pelvis to stop the movement. So they did the job that they were supposed to do. They stopped movement, but the problem is that the story wasn't real. So my pelvis wasn't actually moving too much. I simply had chronic pain. And so because they solved a problem that wasn't a problem, the surgery was a placebo. But the screws and rods are, I mean, they're screws. I don't have any rods, but the screws are actually in my pelvis. They're real screws. It was a real surgery. but it's a placebo because it solved a problem that wasn't really there. So that's why I say it was a placebo surgery, not because the surgery wasn't actually done. I really had the surgery done and I really have real screws in my pelvis, but it was solving a problem that wasn't really there. Let's keep this conversation going in the Facebook group. Feel free to give me a like and a follow, and I can't wait to see you next week when we talk about pacing, because the holidays are coming up and we all get screwed by the holidays because we try to do too much too fast. And I'm going to teach you how to pace so that you don't have a miserable holiday season. We'll see you next week.